The Supreme Court has held up most of President Obama's Affordable Health Care Act, an act which draws heated discussion, debate, and some confusion. To help us sort through some of the what does it mean for me, Dr. Poonam Alaigh joins me on the desk. Good morning.
Good morning, Matt.
So what are the key elements of the Supreme Court ruling on this perspective?
I have to tell you, Matt, for all of us in healthcare, last week was a very exciting week. We were anticipating in terms of how the Supreme Court was going to rule, and two key elements of that ruling actually came about. The first provision was around the individual mandate. Now, the individual mandate is really the financial underpinning of the entire program, and so it was critical to have that individual mandate upheld. And so, based on the Supreme Court's ruling, it was upheld on the grounds of the tax clause as part of our Constitution. In other words, Congress has the power to impose a penalty or a fine in the form of a tax on individuals who do not have health insurance. So that was the one piece of it. The second piece was around Medicaid expansion. In the original law, states who did not participate in Medicaid expansion ran the risk of losing all of federal funding for their Medicaid programs. Under the ruling, the Supreme Court actually declared that the states have the option of opting out without any risk to their, the finances that would come from the government. So those were the key elements of the healthcare reform ruling. Okay,
so all of that in place, let's bring this down to, let's make up a fictitious character. Bob is a freelancer. He's got no dependents, makes $35,000 a year, is paying $600 right now a month for health insurance. Is Bob going to pay more or less?
Well, again, based on the Affordable Care Act, the whole idea is to make sure that every American has health coverage. And it's going to be critical to have that because the insurance model doesn't work unless you have both high-risk patients who are utilizing health care costs and low-risk patients who don't utilize health care costs. So right now, if Bob doesn't have insurance or is paying high premiums to get coverage, then Bob has the option, making $35,000, will have the option of actually going to the state insurance exchanges that are going to be established and really being able to get a subsidy for the health coverage based on the size of the family. So anyone up to the limit of 400% of federal poverty level will have the ability of buying insurance through the health insurance exchanges that have been set up in each state and be able to get subsidies or a discount in terms of their premiums.
So it's still private insurance companies, but there's government subsidies.
Exactly, exactly.
So people are those who are up in arms are saying it's additional taxes, but if you take somebody, let's say Bob has a cousin, Steve, who breaks a leg, his uninsured comes into the emergency room, he can't pay, he's treated, everyone else is paying.
Exactly.
So how does this offset that?
So today for Bob, who, let's say for instance, Bob didn't have insurance, right, was an uninsured patient, what's going to happen is Bob will have the option based on what Bob is making in terms of income, either to go into the state Medicaid expansion program, which is much richer benefit, you're up to 133% of federal poverty level, you can get it through that, or you can get it through the state insurance exchanges with a government subsidy, or if you're employed by an employer with 50 or more workers, again, there's an employer mandate that the employer has to provide insurance to its workers.
Okay, now you're a physician, so you got your ear to the rail and you're by the water cooler. Overall, what would you say the reaction is amongst private physicians in New Jersey when the news came down?
I think overall, from a physician perspective, we like the fact that patients are going to have insurance. The access issue that we're always concerned about is going to somehow get mitigated. Also, there's a lot more dollars going into primary care and prevention and coordination of chronic diseases. However, the concern in the primary care community and the hospital community, for that fact, is it sustainable? Who's going to pay for it? And are we going to get reimbursement cuts as a result of this? Because it is going to cover about 30 million Americans, and sort of the tab on the cost for this is over $1.1 trillion over the next 10 years.
I don't want to get too deeply into this, but a lot of physicians right now are frustrated because, malpractice is through the roof, the insurance is through the roof, and, there's a lot of ambulance chasing out there, which is driving medical costs through the roof. Anything in the bill that would address this?
See, again, it's a very important point. If there was one thing that should have been a little more obvious, it should have been the malpractice reform. That is not part of the bill. However, there are demonstration pilots and programs that will help us as a physician and a provider and a healthcare community to start testing different models. There is a lot of innovation. There is a lot of, provisions that will help transform our care from a utilization-based to a value-based and a quality-based reimbursement system.
Okay. Thank you so much for joining us. It's an ongoing issue with a lot more to follow on it, and we'll have you back.
Yeah, thank you, Matt.
Thank you so much.